Hi, I'm Dr. Joe Pettus. Prostate cancer is diagnosed by prostate biopsy. The word biopsy is simply the medical term meaning to take a small piece of tissue and look at it under the microscope. There are several reasons that your doctor may recommend prostate biopsy. If you have an elevated PSA, if you have a rising PSA, or if there's suspicious prostate nodule on exam. Prostate biopsy is generally a low-risk procedure. Most men will have some blood in the urine, stool, and ejaculation for about a week or so after the biopsy. Most urologists will recommend that you be off of the blood thinners or aspirin for a week before the procedure. The most significant problem associated with prostate biopsy is urinary tract infection after the procedure. To avoid this, your doctor will prescribe an oral antibiotic to start the day before the biopsy. Many urologists also give a single intramuscular injection of a second antibiotic immediately before the biopsy. Despite this precaution, as many as 5% of patients will still develop a urinary tract infection. So call your doctor immediately if you experience fever after prostate biopsy. The day of your procedure, you will be asked to lie on your side and an ultrasound probe will be placed in your rectum. This is a little uncomfortable, but most patients do not consider it painful. The prostate gland is deadened with lidocaine and then measured for size. The size is important for surgical planning and may also help to explain an elevated PSA if it's very enlarged. During this process, your doctor will look for abnormal areas within the prostate. Finally, 6 to 14 cores are taken from the gland using a biopsy gun. The biopsy gun has a hollow needle that fires into the gland and collects a small piece of tissue. Some patients are startled by the popping sound that the biopsy gun makes, so be ready for it. I usually fire it several times before the procedure so you'll know what you'll be hearing. The entire process takes about 5 minutes from start to finish. The tissue is sent for processing and microscopic examination by a pathologist. If there's prostate cancer in the biopsy, you and I will sit down and discuss the results and determine what treatment course would be most appropriate. Prostate biopsy is not perfect, so a negative result does not guarantee that there is no cancer in your gland. Usually in such cases, we'll recheck your PSA in 6 months to confirm that it's stable or decreasing. Prostate biopsy can be a scary experience, but it doesn't have to be. Yes, it's uncomfortable, but it's quick and it's safe. Most importantly, having a prostate biopsy does not mean you have prostate cancer. And if you do have cancer, it's best to find out sooner than later.